Excellencies, distinguished guests, ladies and gentlemen, good morning. Across ASEAN and our neighboring regions, populations are aging faster than ever before. How we respond will shape not just our societies, but our shared future. This makes today's capacity building training on response to aging among ASEAN Plus Three countries especially timely. Your participation reflects our shared commitment to collaborate, exchange knowledge, and learn from one another. I would like to acknowledge the Ministry of Civil Affairs of the People's Republic of China and the China Civil Affairs University for their leadership in organizing this program. Their foresight in fostering partnerships is helping us prepare more effectively for the realities of aging societies in our region. Excellencies, ladies and gentlemen, demographic shifts across ASEAN and beyond are already reshaping our societies in significant and complex ways. This is not a distant prospect. It is a reality unfolding at speed. In 2020, individuals aged 60 and above accounted for 11.5% of Southeast Asia's population, or more than 77 million people. By 2050, this figure is expected to more than double to 173 million, meaning that 1 in every 5 people in our region will be an older person. This demographic transition brings serious challenges for healthcare, pension, and social care systems. Disabilities increase with age. It is estimated that 16 million older persons in our region live with an impairment in at least one primary activity of daily living. This figure rises to 35 million older persons living with an impairment in at least one instrumental activity of daily living. We must also view this through a gender lens. Across the region, women live longer than men, but often spend more years in poor health and face greater financial insecurity in later life. They also shoulder a disproportionate share of caregiving for children, aging parents, and spouses, while sacrificing participation in the formal workforce and limiting their pension contributions. This leaves many at great risk in old age. Our strategies must therefore be gender sensitive, tackling these deep-seated inequalities directly to ensure security for all in old age. Excellencies, ladies and gentlemen, ASEAN sees aging not only as a challenge, but also as an opportunity. This perspective is articulated in our regional framework, the Kuala Lumpur Declaration on Aging, Empowering Older Persons in ASEAN, and its regional action plan, the ASEAN Declaration on Strengthening Social Protection, and the ASEAN Post-2015 Health Development Agenda 2021-2025. Together, they promote inclusive and resilient aging societies through a whole-of-government and whole-of-society approach, integrating gender, age, health, and care perspectives into the fabric of workplaces and communities. Our political commitment is reinforced through ongoing dialogue and cooperation. The 12th ASEAN Ministerial Meeting on Social Welfare and Development, together with the 8th ASWD Plus 3 meeting in August 2025, reaffirm our pledge to improve equitable access to inclusive, adaptive, and future-proof social protection for all, with a special focus on older persons. These forums highlighted the need for stronger community-based services, expanded home-based care, and greater investment in training social workers and caregivers. Our broader partnerships further reflect our shared interests. The ASEAN Plus Three Statement on Active Aging captures our collective resolve to integrate the principles of active aging into national policies and action plans. It also articulates our commitment to enhancing social protection and healthcare services and promote capacity building to develop innovative solutions for a supportive and inclusive society. ASEAN institutions play a central role in translating vision into action. The ASEAN Senior Officials Meeting on Social Welfare and Development, SOM SWD, has spearheaded regional initiatives on aging that focus on ensuring access and opportunities for older persons and fostering an inclusive aging society through an intergenerational approach, among others. Most recently, under Malaysia's leadership, SOM SWD convened the ASEAN All-K Conference on Care and Support for Older Persons in June 2025. The meeting put forward important recommendations from ensuring the dignity and autonomy of older persons and strengthening family and community-centered care to promoting equity and inclusion across generations and supporting innovation and knowledge-driven transformations. The ASEAN Center for Active Aging and Innovation, ACAI, established in 2020, is another example of this strategic approach. ACAI is evolving into a regional knowledge hub that supports evidence-based policies, spearhead capacity building programs, and foster research and innovation. It strengthens ASEAN's collective efforts to foster inclusive, active, and age-friendly societies. Excellencies, ladies and gentlemen, looking ahead, the ASEAN Community Vision 2045 provides a clear path that puts people at the very heart of our community building. A central principle is the promotion of intergenerational solidarity. Older persons should not be seen only as recipients of care, but as value contributors to our societies. Their capacity can be strengthened through targeted retraining and reskilling, allowing those who wish to remain in the workforce to adapt and seek new opportunities for re-employment. By doing so, we harness their experience, knowledge, and resilience, resources our society cannot afford to overlook. As this training program unfolds, I encourage you to share your national experiences and learn from one another. Utilize this platform to strengthen our collective capacity, design strategies that respond to the specific needs of older persons, and promote policies that uphold their dignity, autonomy, and well-being. What we do today will determine how future generations experience aging, whether with dignity and security or with vulnerability. Let us work together to ensure it is the former. Thank you.